Welcome everyone to today's webinar, Producing Value with a Balanced Outcomes Approach to Workforce Management. Kalispell shares their strategy. I am Ayla Ellison, Managing Editor for Becker's Hospital Review. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We look forward to hearing your questions. This session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. I will now turn the floor over to Dr. Carleen Kerfoot, Chief Nursing Officer, API Healthcare, to begin the presentation.
Hi everyone, we're really glad you can join us today for this very special presentation. Kalispell, as you'll soon find out, is a very special place in our world, and we are honored to be able to work with them, and we're honored to be able to present their special mission to you. Let me tell you who is here from Kalispell. First of all, Chad Mack. He's the Director of Productivity and Performance Improvement there at Kalispell. His background includes an education background in healthcare administration. Chad focuses on workforce management from two perspectives, clinical and financial, which is perfect because we know in some cases people either do one or the other. But as we're talking about outcomes, he really does the balanced outcomes by being able to balance the clinical and the financial perspective. Another important thing that Chad does is he partners with leaders throughout the organization to achieve the kind of results that you'll hear about today. And Deb Wilson is a registered nurse. She's been a registered nurse for over 30 years. The special skill that she brings is leadership positions in a lot of different areas across the continuum, across the care continuum. And we know in terms of outcomes, we can't just focus on one unit. We have to focus on the continuum. So Deb brings a lot of very important information to us from that perspective. Before they start to talk about their very special mission and what they're doing, let me add a couple things. You know, we're really looking at moving from volume to value, and we absolutely know that between volume and value, we have to look at outcomes, because if we don't look at outcomes, then we're not really looking at value. So we're just doing things that don't make any difference. We also know that one of our challenges is sometimes those outcomes aren't balanced. Sometimes we think about the financial, and rather than really look at the downstream consequences of some of our financial decisions that impact the quality of care, impact staff engagement, and things like that, we don't do that. But what we have to do is make sure we can balance those outcomes so we don't look in just one area and then cause downstream consequences in another. For example, you know, you can start a new service line. And as you start a new service line, you can say, wow, you know, the financials show that we're going to make a whole lot of money on this, but if you don't have the right staff, if you don't have the right training, if you don't have the right quality outcomes, it's going to be a financial disaster. So all kinds of things have to go together in a synergistic way to get what we need to do today to be able to create the value that we're getting paid on and the value that people demand. So in summary, it's all about balance, balance, balance. And if we focus on one or the other, we don't have balance. And if we focus on all of them, we do. So in summary, it's optimized workforce outcomes right there in the middle that can get us to all those different outcomes that we need to think about for the future. And of course, you know, there's a lot of processes and things behind this. So as we think about turning workforce data into better outcomes, let's think about the kinds of things we need to do. First of all, you know, we got to think about the continuum, and Deb has a great background for that, as well as many other people in the organization. We also have to think about the people, and it's not just bodies. It's the right credentials, the right staff, the right attitude, all that kind of stuff to make it happen. And then policy, if we don't have the right policy, then sometimes things go all wrong. For example, if we have a policy that you can't hire until somebody leaves, that's a problem in terms of nursing because you've got a gap you have to fill with overtime. And also processes. We know a lot about lean and all kinds of processes, Six Sigma now, that the processes are really important because they create the reliability and the repeatability. Data, data, data. we have lots of data in the system, but we don't use it. And in the past, we haven't used patient-centered data when we've done staffing. We've just looked at numbers, and we know the rest of that problem. We also haven't looked at staff, and then we know what those outcomes are. And we also haven't really looked at operations. So we have to look at data from all three sources to be able to do patient-centered staffing that will get us to the right outcome. And of course, technology. One opportunity is technology that goes across the continuum, because if we have different workforce solutions in different places, then we can't really talk to each other and we can't really look at outcomes. Integration. We know that it's really important to be able to integrate and predict. If we know what's coming down, then we can prepare for it. If everything's a surprise, we can't do that. And mobile technology is offering lots of interesting things for us now that we didn't have available a few months ago. And to make all this happen, of course, we have to have the right change management. And probably another really good word for change management is adoption. Because if we have successful change management, then people adopt it and they say, hey, this is great. This is really, really good, and we can do this. And also leading practices and processes. We might as well not reinvent the wheel, because there's a lot of people out there with leading practices and processes that we can just copy and put in place. Finally, outcomes. That will get us to the outcomes that we need, those 5 outcomes. If we do all this kind of stuff that we've been talking about, we'll have great success in financial, clinical, staff engagement, patient experience, and compliance. It sounds simple. It really is simple. And here we go. Let's have our speakers, Chad and Deb, tell us how to get from here to there. So take it away, Chad and Deb.
Well, it is really nice to be able to share what we've done so far. We're certainly not finished by any stretch, and we'll talk about that a little bit further into the presentation. But for those of you that are not familiar with Kalispell, we're kind of a unique location in northwest Montana, very rural, and we also have the unique characteristic of being able to offer a wide variety of services throughout the continuum. So we have over 40 clinics, and even within the clinics we have a robust behavioral health component. We have service lines, including oncology, which includes radiation, medical, and surgical oncology, orthopedic, and cardiovascular service lines, just to name a few of them. We also opened up Montana Children's recently in July, and that is a 30-bed facility that has PICU, NICU, and pediatrics. And then overall, our staff is comprised of 400 physicians and approximately 4,000 employees. So about a year and a half ago, we recognized the need to really start looking at our workforce management process. Just like everyone else in every part of the country, we have not been immune to the pressures that healthcare providers have been feeling. We've had changing reimbursement, and rarely does that go up. It usually goes down, and increased emphasis on value, both from our payers and our community and patients. And for us, another thing that is unique is that we have seasonality. And this seasonality has had a dramatic impact on our ability to give care. So in the summers, we have a significant influx into the valley, which gives us additional challenges. So with these market pressures and recognizing the importance of our workforce, we knew that we had to have a sustainable, readily available, and high-quality workforce. That is truly the lifeblood of our organization, and that's what makes it such a priority for us.
My name is Chad Mack, and I'm the Director of Productivity and Performance Improvement for Kalispell. And so as we begin to talk about our journey on the life cycle of labor, as Carlene mentioned earlier, we're approaching this through a balanced outcomes, not just focusing on financial or one of any specific things. We're looking at financial, clinical, staff engagement, patient experience, and compliance at the macro level. And so I think that's important to understand that I don't want to mislead anybody to say that, because of what we're doing with staffing and scheduling, or what we're doing with time and attendance, that all of a sudden, our clinical scores, our quality is just going to magically go up. That we're not fooling ourselves in that aspect. Really what we're doing is the approach that we're taking is saying all of the incremental changes that we make at individual departments across the continuum to keep the bigger picture in mind with those key performance indicators in those 5 areas, to make sure that, one, there's not a causal effect, or 2, if there's some correlations that we're starting to see that are, making the outcomes unbalanced, that we can course correct in relatively real time because we have the data and we're measuring and monitoring that. One of the things is a lot of times productivity is seen as a financial component, as just a cost-cutting initiative. And although it has an impact as you become more efficient and you're able to do services at a less cost per unit in terms of labor supplies or whatever it is that you're monitoring, we realize that, and kind of you'll see this throughout our journey, is that as we've been defining what the clinical aspect and what the patient experience and staff satisfaction, they're all interconnected, and we've come to that realization that, if we do X, yes, it will have a financial impact, but it could have downstream effects that are correlating through that. And so that's what we're looking at. Of course, we're looking at, people, policy, process, and technology. We have a good foundation here as in terms of process improvement, and we're continually improving on that. But really, the partnership with API is leveraging technology to take us into the future. That the next generation of staff and employees coming up in the workforce are going to come to expect of any employer, and so we're trying to get ahead of that curve. And then of course, moving as a team. This is not just acute care nursing. This is not just certain departments. As Deb will explain later, she'll give you a sampling of the departments that we have in some of our pilot programs and the differences among services and overhead versus direct patient care, et cetera. And again, it's enterprise-wide. So as we'll go through the 5 outcome metrics that we're looking at. So the first one that we're looking at is obviously when we're talking about productivity, there's going to be financial impact and outcomes that we're striving for. We want to make sure that what we're measuring up front, to the best of our knowledge, is what we think will yield us the best results. So just as probably everyone on this call is, they're looking at their premium labor spend in terms of overtime, their callback utilization, incentive bonus shifts, and things like that. We're looking at payroll leakage, which includes how effective are we at making sure that all of our staff are getting their appropriate meals and breaks, so that it does not lead to the incidental or incremental hours. And then productivity, so that's relatively self-explanatory, making sure that although on the macro level we're looking at outcomes and the value, we still have a focus on making sure that we have the right people in the right spot at the right time, given the needed resources to produce given X care. And then, one of the other things too that sometimes it's easy to lose sight of when you're looking at productivity is the non-productive time. And so making sure that we are monitoring that as well. That is unscheduled absences, orientation, meetings, and then things that we're doing specifically to target that. And so just as an example of for non-productive time, we've just instituted a thing called RQI, and that's for CPR training, where they don't need to go to a class and clock in. It's all on the computer, and so all of those types of things from the financial side, which is fairly standard, is we're looking at all of that stuff.
So again, the key clinical outcomes that you see on this slide: reducing readmissions, reducing length of stay, as well as the reduction of hospital-acquired conditions. This is not unique to us. These are the things that all healthcare organizations are truly focusing on. We identified early on, as Chad kind of alluded to, that we cannot look at just clinical or just financial when we're looking at this process. It was clear to us that it was more of a circular process because not one thing stands on its own, which means we can't change one thing in isolation and not have the expectation that it potentially could impact another. And, you know, from my experience, this is a perfect example of systems theory. They all impact each other. And the other thing that we know, either as nurses or as leaders, is that when you have the appropriate staffing, no matter if it's nursing staffing or any other type of staffing, it can positively impact these clinical outcomes. And that was important for us.
So, in talking about staff engagement, which is another section of the 5 outcomes, I'm going to talk briefly a little bit about to make sense for the audience. You know, when we start talking about this stuff, some of the things that we're doing and partnering with API. And so when we're talking about staff engagement and we say, okay, we want to improve work-life balance and you know, increase staffing equity, I think to give you perspective on that, what we have is in partnership with API, we have the whole suite of products in terms of workforce management. So on the front end, we're just implementing staffing and scheduling. We already had time and attendance, and then we'll be implementing outcome analytics, which is a cloud-based analytics for productivity and data. And then on the back end, we have a product called patient-centered staffing, which it's going to we utilize Meditech, so it's going to plug on to Meditech, and it's going to look at the documentation and the patient's actual needs, and then be able to better assign resources given the patient's needs, as opposed to looking at kind of historically how we've done it and kind of how it works across the country is, you know, we staff med-surg 5 to 1. This is, okay, well, let's look at the patient's needs and then let's determine staffing. Let's not look at it from necessarily a financial function. So when we talk about staff engagement and we say, okay, we want to improve work-life balance, we want to increase staffing equity, reduce turnover, some of the actual nuts and bolts of that, and we'll get to this later as we talk about the project, but we're talking about, you know, I talked about taking us, you know, into the new age of, you know, utilizing technology. You know, do the nurses now have the ability to look at their schedule and say, okay, you know, do I work this Thanksgiving, or can I institute a shift trade from my phone, or can I request to work here, or can I request to be unavailable here, to put the work in the staff's hands instead of, you know, sending out an Excel sheet and saying, hey, this is your schedule for the next 4 weeks. You know, being more transparent with all of that through the technology that we're instituting, we believe will have a very large impact on the staff engagement. You know, one of the things that we have now is we have, you know, mobile time management, where you know, we've said, okay, it's the responsibility of all staff to be able to make sure that you sign off your time card that it is accurate to the best of your knowledge. Well, if you leave work and you forget to do that, you can download the app and do it from your phone. And so we're making it, you know, trying to add the convenience factor that we believe that, you know, this workforce and coming workforces in the future are gonna grow to expect that, you know, if you can go on your iPhone and download an app and figure out, you know, the distance to, you know, this nearest city with step-by-step instructions, but, you know, you're receiving your schedule over a text or an Excel spreadsheet, that just doesn't jive with how, you know, their life and their reality works. So we're working to increase staff engagement through those types of things, to be specific and not as broad for the audience.
And of course, as all of us, we're healthcare providers, so we want to make sure that patient satisfaction is at the forefront. We know that through a patient stay, many disciplines can and do impact patient satisfaction. So that's one of the reasons that we didn't want to just focus on nursing, but if we put this into place, we wanted to make sure that it would work for everyone. So to that end, we wanted to focus on that interdependence within our organization, which led to a varied pilot group. So in our pilot group, we of course have nursing and a variation of nursing floors, et cetera, but also we included some of the ancillary services. So we included nutrition services, lab, housekeeping, and we currently have a daycare, and we even included the daycare in that, just to see how varied this product could be and how we could make it used. And of course, we know that happy staff equal happy patients. So we wanted to really capitalize on that because we wanted to improve our HCAP scores, and that's a focus that we have all the time. And we also know from the research that is at the bottom of the slide that when you can really link nurse job enjoyment with the quality of care. And from my experience, that's just not nursing, it's throughout all disciplines.
So given the outcomes that we just discussed, talking about kind of the journey that we started on, we took, after engaging with API, we decided not to just shotgun the product and just say, okay, well, here's all the technology that can be used. Let's just institute it and see what happens. We wanted to be much more thoughtful in this approach as we wanted to look at it from a strategic framework, and we realized early on that if we just institute the product, we will achieve the results that we're incentivizing. So if we institute the product, we get dashboards, we can hammer home, overtime, we can project overtime, we can use all the analytics in the world. But we wanted to step back and create a roadmap for ourselves to say, all right, well, this is great and technology is powerful, but it also has a great responsibility, and we understood that right away. And so one of the things that we've done is in working with APIs, we've had several pre-planning meetings to go over the 5 balanced outcomes, and for each individual one, we had the whole executive team representation at the table. So that includes, we have, even when we were talking about financial outcomes and what we wanted to measure and look at, we had HR, we had the chief nurse executive, we had Deb, the COO, we had the chief financial officer. And so we're not isolating, we're not saying, okay, CFO, you determine, what the financial objectives are. We sat down as a team and as a group to say, okay, this is what we're looking at from a financial perspective, and we know that these things link, at a macro level, kind of all across the board, and are we all okay that, these are the indicators that we're going to look at from a financial perspective, from a clinical perspective. And so that was, I think one of the biggest things that we did. And then of course, being that, where we are geographically, in all of the troubles with recruiting and nurse turnover, is that every single resources that we have in our organization is extremely valuable, and we need to make sure that we are as efficient as possible, but to be able to fully leverage and utilize those resources, and technology is a great way to be able to put the systems in the hands of the employees so that they can spend time doing what they are trained and hired to do, which is to take care of the patients and to take care of the community that we serve. And so that's where technology plays a large role. I talked about the metrics, and then the implementation plan in working with API, like I had said, is it wasn't, we purchased the product in right December of 18. And so it's been a year, and we're just about to kick off staffing and scheduling, which I'll talk about. And so we've really used the good part of this year to really plan this out in a thoughtful approach so that we can get the most out of the technology while yielding the results that we want and that we're expecting. One of the things that we've done in conjunction with the staffing and scheduling suite that we have coming live here very soon is to realize that we are a system, and we have a ton of systemness and opportunity to be more of a system. And so one of the things that we've realized early on is that we wanted to do a centralized staffing office, again, to one, better utilize and leverage the product so that we don't have specific departments operating in isolation. I talked about that every single resource that we have is absolutely valuable and we need to leverage that. And we found that with individual departments doing their own staffing and scheduling and deploying resources day of and utilizing PRNs, that if we became and merged that into a centralized staffing office, we could then leverage and be able to get the community and the patients that we serve the available resources at the right time at a global view with somebody looking at it, from a 10,000-foot view as a centralized staffing office that's, pulling in all the volumes, knowing who's on call, knowing who's scheduled, who's qualified to work. If we don't have somebody, can we leverage technology to be able to send them a text message to say, hey, we have an open shift coming up at 7 p.m. Do you want to take that shift? Reply yes or no, and it will put them on the schedule. And so what we've done for the centralized staffing office is we've started relatively small, but we've started with acute care nursing in all of the nursing departments that are going to be utilizing the centralized staffing office. But as we are implementing this, we're seeing a ton of cross-pollination that we can leverage within Deb's departments, with ancillary. Can we have a centralized staffing office that can do food nutrition, EVS, laundry, and things like that. So that's one of the big things that we've done in conjunction with the technology to better utilize the technology. And then I've talked a little bit about the technology, but this is just to go over what we're doing. When we engaged API to become partners in this, we had already had the time and attendance product. So all of our time clocks and our time cards were utilizing API, and so we needed to upgrade that so that we could, the functionality of staffing and scheduling and outcome analytics could all tie together. And then, like I said, on the front end, we're implementing staffing and scheduling. And so what we've done with our pilot groups is define and standardize as much as humanly possible in terms of definition. So are we going to do 4-week schedules or 8-week schedules? We've made all of those decisions as a group with all of the stakeholders in the room, and I mean, that's been, I think, probably 2 months of working with API, looking at best practices, reaching out to other organizations to say, hey, so, how does this look, and what's the benefit of doing this as opposed to that? And so that's the staffing and scheduling. I talked about the usage of the mobile. We have mobile time management, and we've always had it. But when we incorporate the staffing and scheduling, you can leverage it a lot more. So again, I can be at home on Monday morning and sign off my time card, or go in and put in vacation time or sick time or whatever I need to do. But then we can also, like I had mentioned with the functionality called open shift notification, if the centralized staffing office has a gap day of, they can say, okay, I want to see everybody that's qualified to work this shift and anybody that's been orientated to this unit, and I want to be able to send out an SMS or a text message and say, there's an available shift, do you want to take it, yes or no? And you reply via text message, and then it puts you on, and it has the ability to put you on the schedule. And so that's really, what I talk about is, that is what, I would expect if I was, a frontline staff member, as just, in the world we live in, that, yes, my employer should have that. I mean, it's going to become, I think, an expectation in the future. Outcome analytics. So right now, when it comes to productivity reporting, we utilize a product from Meditech, and it's called BCA. And BCA is much more than just productivity. But the reason why, and BCA has been great for us, and we like it, and we're still going to use it for other things. But what we found is that when we really want to start to be able to put the analytics and data in the hands of the managers as real time as we can possibly get it. And so as we go through with staffing and scheduling, the data and analytics that we can get and put in the hands of our supervisors and managers becomes exponential, because we know that we have, a clinical lab scientist scheduled at 8 a.m., and we can see then through the data when they clocked in at 8:15 and they missed a lunch or whatever it may be. And so we can start using those analytics to say, okay, this staff member is scheduled for 40 hours this week. They were scheduled for 8 hours this day. They worked 8 hours and 30 minutes, so we're already projecting overtime. Are there any real-time adjustments that we can make? And so I think a lot of the times is getting the data as real-time as we possibly can get it, so we're not looking at productivity from 14 days ago and saying, hey, it wasn't a good day, what happened? And then going back to dig and figure out what happened when, that could be occurring right under our noses as we speak, and we don't even know it. And so that's really the technology that we're looking for, that we're getting. And so that is really, really good. And then the patient classification, I talked about that. It's going to plug onto Meditech, and it's going to look at the patient's acuity and orders and documentation to say, hey, you know what, this isn't a 1-to-5 ratio, or this isn't a 1-to-3 ratio. These 3 patients are actually more acute. And so it can help us in the centralized staffing office make better assignments so that we can then ideally impact those global metrics that we're looking at in terms of quality and staff satisfaction and patient satisfaction with HCAHPS and things like that.
And it really is an answer to what our leaders have been asking for. Our leaders want to be able to lead and manage real time, and this will enable us to do that.
Absolutely.
So from the very beginning, of course, we were concerned about sustainability, and we recognized that this was not going to be a finite endeavor, and instead, it was really a commitment to our future. As Chad was talking about how long ago it was that we purchased the product, and here it is, we're just, making some of the steps that we wanted to make. We knew it was going to take some time because we wanted to do it right. Because truly, this is our path forward. This is where we want to make sure that we are doing this the right way, have the right people at the table, and with the right goal in mind. So given that, we implemented a steering committee that was comprised of all of our pertinent stakeholders, and that was done from the very beginning. So as we went, we found that some of the more complex schedules that we would deal with would be from a nursing component. So we would defer to them and then see if other things would work for some of the other ancillary departments. But it really was that stakeholder group that helped us move forward. So they oversaw the projects as we went and made sure that the projects would tie into the original charter that we had done. One of the things that we were able to do is go from different pay dates to one pay date. And for 4,000 people and multiple entities, you can imagine what a challenge that was. But we then also created subcommittees, such as our IT subcommittee, when we really needed them and relied on them to help us with the technology. So it was through that group that we also developed and then made sure that we aligned our data points, and we did that as a team, not individually. And so we did that at the executive level, as Chad was speaking about, with the CFO, CNO, COO, but we also did it with our middle management team as well. And I think that has really allowed people to feel like they have buy-in, and they certainly have had influence as to how we've gone.
So I've talked about the outcome analytics, but I can touch on it more briefly here. So one of the things that when we talk about improving, and the way that we kind of have it set now is that a productivity report comes out Thursday or Friday after the pay period closed on that Saturday night. And so one of the things that it becomes difficult to do with a lack of analytics and data, and I'm not saying that we don't have it. BCA is wonderful, but the timeliness of it, due to the time and attendance data that we need, it becomes really tough to course correct in real time and really, and it's not about holding people accountable, but it's making people accountable for their own business units in the way that they appreciate it and understand it. They all want to do this. And like Deb said, this has been something that, this was an ask from them. When we started productivity, they said, bring it on, let's do this. But where's the data, and where do I know that, real time, do I need to make an adjustment or not? How do I know that, given how big and complex our organization is, which is a great thing. And so this is one of the things that, we've instituted to have, dashboards, productivity dashboards, daily dashboards, where they can drill down by day, by job class, by employee, and say, that does look odd, or hey, maybe I should tweak my schedule because I'm seeing, every Tuesday my volume dips a little bit, and so if I make a slight adjustment, what will that do in the grand scheme of things? And so being able to go through the continuous improvement, we need to have the data and the analytics at our fingertips, and not, when I say at our fingertips, not at my fingertips or Deb's fingertips. We're going to help them, but really at the frontline staff's fingertips, so that they can make the decisions they need to, within a time frame that's going to prevent something bad from happening in terms of premium pay or outcomes. That, hey, volume is up, I need to send a text out to ask if somebody can come in and work. It goes both ways. And then, of course, visibility at all levels, so that, as we have our core steering committee to say, okay, this is what we said we were set out to do. Is it working? Well, in the world we live in, it should take a couple clicks of a button and say, yeah, it's looking pretty good, or it's not, and then we regroup and say, okay, well, what do we need to change? And then obviously continually looking at it from the balanced outcomes approach that we've decided to do. So lessons learned this far, I would say, and I have one extra one that's not on here, but I think in any endeavor, regardless of whether it's through the workforce or whether it's through whatever you're looking at, and I think we all know this, but leadership collaboration is essential. If it's not a commitment from the top end of the organization, then it's really, really hard to push a rock uphill. And so that's by far, I think one of the best things and one of the biggest things that we could say, this has got to be important to your leadership team. Otherwise, it's going to be really, really hard to say that we're committed to this. I think getting people excited and being able to paint a picture of the future that people are excited and they want to come to work every day and say, look, we're doing this. We're not doing this just to cut costs. We're doing this to be able to leverage every single one of you to the maximum capability of your training. And so we're going to use this through technology. And I think as we go forward and technology becomes a bigger pie of every single person's life, this is something that is probably, and I'm just going to go out on a limb, is going to be a non-negotiable in the next 5-10 years when we get the new wave of employees coming through the workforce. If they just won't put up with not having the information and the data at their fingertips that has something to do with such a big piece of their life, which is work. And so, we take that responsibility very seriously as an employer. And then, alignment and buy-in across all departments. I think that is directly correlated to leadership collaboration. When we started picking out the pilot departments, every single executive, went back and said, okay, yeah, let's get some people excited and just kind of go with who wants to do it. And so we have a myriad of departments. I mean, from an on-site daycare for our employees to lab to nursing, nutrition services. We have a laundry department that does our linen, and they're all coming up on pilot groups. And so really making this not just about, well, we're just doing this for nursing or we're just doing this. We're showing that this is going to work for everybody, and eventually we're going to get everybody up on it. And then we also understand greatly especially going through the balanced approach, that making sure that we have the analytics we need to be able to even roll this out. And so I think that's where one thing has been great, that Meditech has been great with BCA to get us really good baseline data. We already had the time and attendance payroll data, but being able to really track and measure this for the desired outcomes is huge. The last thing that I'll say that I think is a huge lesson learned that we forgot to put on here is the collaboration with information technology. And we have, Deb can attest to this, our project manager from IT, her name's Lindsay, and she is literally the key to all of this. And I know that, sometimes organizations deal with it and, they have these really big goals and lofty goals that they want to do, and IT is a barrier. Well, for us, IT enhances everything that we do, and we're so fortunate to have such a robust IT team that is also, looking to the future and is aligning the vision with the organization's vision. And I think that can't be understated. And that's one thing that has been a huge blessing for us. That's all we have.
That was really good. Thank you so much, Deb and Mack. That was and Chad. That was really important because I think, Chad, you were able to really concretely talk to us about the significance of being able to balance outcomes and create the kind of value. And Deb, you were so articulate about how important this is across the continuum and how it's really important that, it's really staff that make all the difference. You people have done a nice job of talking to us about, creating joy at work, and I think that's exactly what we need to be doing for the future. So thank you so much, Deb and Chad, and I'm also very grateful for the roadmap that you people provided, because, it's one thing to talk about it, but it's another thing to talk about the infrastructure that you are creating through the roadmap and the central staffing office and the technology, and the important thing about making it sustainable, which is really, really important for our future. And, of course, analytics, which is one of the basics of everything we do. So thank you so much, Deb and Chad, for all your work and all your help with this. It's really, really, really exciting. And we do have some time for some questions now. So let me start with a couple that have come in. Let me start with a comment. And one person said, such a key point to include all the staff. The care experience indeed includes everyone at the facility across the continuum. So that's a real endorsement of your, the way you're doing things and how you're making things happen. We have a question here about acuity. How is the patient acuity being measured and factored into staffing? Either one of you want to answer that one?
So I can take a stab at it. If API could help with that a little bit, or we can get back to the question offline. One of the things, so we haven't rolled that out yet. That's the last phase of the rollout. Like I had said, we're just about to go live with staffing and scheduling for the core groups. But I saw another question: is it an acuity tool? And yes, it is. And how it determines that is it's an algorithm that plugs on to Meditech, and it looks at I think the patient's diagnosis and what has been ordered, and it also goes off of the nursing documentation. So one of the examples is if there's it even has the ability to say this patient's family has been asking a lot of questions, or there's an issue with the family, it will rate that patient higher. In terms of the actual technical rating system, we would have to get back to you, and that would be more of an API question.
Yeah, I think I can also add that the advantage is it's integrated with the staffing system, so that as the information comes across from the medical record about what the patient needs, then you can really do patient-centered staffing, because you can bring that over to the assignment screen, and then you can look at the people that you have on board, the credentials and the skill mix, and so on, and then you can make sure that the assignment with the patient is the right assignment for that particular staff. So definitely it's an integrated system that looks at, matching the patient with the assignment and the staff. So more to come on that. There's a question here about, you talked about the executive team working collaboratively on this initiative. What about frontline managers? Not frontline managers, but also frontline people. Anything else you want to add to that in terms of the ability to get the frontline people as well as the directors and managers involved? You've done a great job with that.
Yeah. So in terms of the Frontline Management. Through all of our workings, over this, these 9 months since, we said, okay, we're going to do this, we have brought in, supervisor, manager, and director into all of the planning meetings in regards to the pilot groups. And so one of the things, if anybody on the call has API staffing and scheduling, how much actually goes into making the decisions in regards to how we're going to set the system up is absolutely incredible. And it really opened up my eyes to it. Things like where you're defining, and one of the other big partners that we have is HR with our policies. But we have things like, we have to tell the system, what is the maximum work stretch or what is the maximum worked hours that we will allow. And so, we would reference the policy, and then we had all of the departments in there to say, okay, well, what are you guys using now, and how are you running your departments now? Because we knew very early on that we had, and it's not a bad thing, but we had all of the departments doing things differently. And so when we had brought all of the teams in, Deb and I and the executive team couldn't answer, how many people are you letting off on how many vacations per shift per job class are you allowing at one time? We were like, well, I don't know. We have to talk to EVS. So we've got everybody in the room, and it was actually quite fascinating because all of the departments began to collaborate together. And so we had the nursing staffing office, and then we had housekeeping, and we had lab, and we had kid care, and so we would challenge them to standardize as much as possible. So they had to work together and said, well, this is the pros of doing a 4-week schedule, and they were saying, well, we would like an 8-week schedule, and so we had to continue. We spent weeks and weeks and weeks hammering out the details with the frontline management, and so that's really the big thing in terms of the frontline staff. That's something that we're about to embark on now. Is we're about to go live next month with staffing and scheduling. So we're about to kick off. We've had, like Deb mentioned, we're taking the move to one payroll. We had 2 different paid dates, and so we're standardizing that to one so that we can, one, drive better analytics, staff satisfaction, that you don't have concurrent schedules with, this time card is finalized on this day, but we have a staff floating from a different entity that, and it got all really crazy. And so as we roll this out to the staff and the education, we will keep you updated. But, yeah.
Well, and I guess I would add, too, that's where when Chad was talking about our project manager, that's where it is so key to have a good charter and also someone who is very adept at keeping you in line as far as schedules, as far as dates that you need to have things completed. Because there were many times where we would talk to our managers and they would take it back to their staff and they would have conversations and then come back to the steering committee. And, that's really all a part of change theory. We did not want to surprise people. We wanted to be transparent. We wanted to let them know how good we felt like this was going to be, but we wanted to also include them. So I think that was a key thing as well.
Great. We have a couple questions about staffing. Number one, can you share more information about how you've standardized your staffing and scheduling policies and why that is so important? Deb or Chad?
Well, again, as far as the policies, that's where it really came to us getting in a room and taking the time to go detail by detail. And we did have, it was almost like a standard operating procedure where we would go through question by question and we would all weigh in because we knew that the more time we spent on the front end, the better off we were going to be on the back end when it would actually go live.
Yeah, and just a little more detail, like in terms of standardizing the schedule, let me give you a concrete example. So when we were sitting down with the pilot departments, we said, okay, we want to move to a standard, as close to a standard scheduling period as possible. And so I think we started off with nursing. They were like, well, we want to do a 12-week schedule. It will give everybody transparency. They'll be able to, work-life balance. It'll be able to put that they'll be able to know their schedule. They'll be able to plan their life around it, their daycare. And so then we had done a quick test, and then we came back and said, okay, that didn't work exactly how we wanted it. And so then we settled on, I believe it's a 6-week or a 4-week schedule. We have 2 different variations. So in the pilot departments, we have some departments that are on, and I just don't want to misspeak, but there's so much details in it. But I think there's some departments that are on 4-week and some that are on 6. And we had departments that would schedule week by week on Excel. We had some departments that would schedule every 3 weeks, 4 weeks, 5 weeks. And so as we're telling the system how we want to work, it was a great opportunity for us to standardize. Some of the things that we've standardized is, in terms of scheduling is, will you allow an employee to schedule themselves into overtime for self-scheduling? And we said, well, we don't, if the need is there and we need to take care of our patients, we don't want to prevent that, but it needs an approval from the person approving that request. And so there needs to be a comment. And so then we can pull reports from that and say, okay, there seems to be an issue in this department. They're continually self-scheduling into overtime, et cetera. And so, there's I think it was like a 56-page document of over 300 standardization topics that we went through. And it was really fascinating, actually. And it was really cool to see all the departments weigh in on everything and to see like, well, you really got to learn a lot about, well, my employees they like this and this is why. And then we would just talk about it. And sometimes we talk about one line item for 30 minutes, 45 minutes to make sure that, we were making the right decision. But again, in terms of all of that, what we always brought it back to, like when we brought it back, we always brought it back to the patients. And we said, okay, so if we do this, if we say, yes, we're going to allow them to schedule into overtime, and we don't require an approval with a comment, is that going to positively impact our patient? If we just give people free rein to do that, it's not that we're not saying that we don't understand there's a time that they would need to do that. And so that's really where we spent a lot of our time is to bring it back to the patient.
Good. We have another question here. Will centralized staffing remove the involvement of the department leaders for input and management?
So it won't remove the involvement. What it will really do is it will open up the communication and the needs. And so one of the things, and it's been a great win for our management, because what a lot of this technology will do it will yield efficiencies from our managers. So instead of spending 5 hours every month working on schedules, the centralized staffing office is going to do that. They're going to do the schedules. They're going to do the daily maintenance. But there's going to be constant feedback loop communication between the departments to the staffing office, so that really the monotony of doing those daily tasks is going to be centralized to people that are experienced and have the optimal, one, view, and two, can look at what's going on across the whole house. So yes, a lot of that is being taken off their plate, and that's been great feedback for this. One of the other things that we didn't talk about in here, just for centralization, is we're also doing centralized timekeeping as part of this. And so we didn't talk about that, but we did a centralized staffing office and then centralized timekeeping, which is also going to help with, hey, we see that you have a missed punch, and we're going to have people that are constantly looking at the time cards for that type of stuff, and then for consistency with how we are utilizing our pay practices and policies. So, do we have a department that says, hey, I need you come in on incentive, or hey, I'll put you back on callback, to make sure that things are being consistently, so that we have equity all across the continuum, so that it's not like, well, I know that when I work for this department, I can get incentive pay because I know the leader there. Not suggesting that we have that, but just preventing any conflict and making things as standardized as possible.
Mm-hmm. Great. We have several questions about along this line. When did you move to API, and what was the driving factor to choose API over other vendors?
So that's a two-part question. I think, and Deb's going to have to help me with the original. So I've been here for 1 year. I got here just over almost a year and a half. And so when I had arrived to Kalispell, we were already utilizing API.
For time and attendance.
And I don't know when that was done.
Yeah, and that, we probably had API, I would say, 4 years.
4 years.
Yeah.
Okay, so there's the first piece of the answer. The second piece of the answer was actually quite simple. One, I know that the transition to API 4 years ago, we spent a considerable amount of time and resources to get that in.
Right.
And so, as we were looking for, a solution for all of the stuff that we wanted to do, we had already had a really big piece of the building block. And so a lot of it was just simplicity of we have all of the data sitting out there in time and attendance. And so what do we want to do? What we wanted to prevent, in all honesty, was having systems that plug onto other systems and to have that whole, just silos of systems where it doesn't flow. The thing about having API on the front end of time and attendance was that now, once we get staffing and scheduling, that just plugs onto the front, and then all of our analytics can feed right through that. So it was almost a no-brainer in terms of continuity of systems. And I know that in healthcare, we have a system for this, and we have a system for this, and you go here to get that.
And this one doesn't talk to that one.
Right, and it doesn't produce the data that we want.
Right.
And so this was just kind of a no-brainer that, okay, let's get a system for workforce that is just seamless, and we already had a huge piece of the building block, and so we wanted to leverage it.
And again, I think Chad spoke to this in the presentation, we wanted to do it the right way. And this felt like the right way to us because it would be seamless, and that was really important.
Great. We have just a couple of minutes left. We have a question here. If you could choose one tactic that had the most impact for employee engagement, what would it be? What would it be? That's a tough one, right?
Yeah, that's a good one. Let me just go back here to see what we said on employee engagement. I think I already know my answer, but I just want to. So the question is, what's the driving factor for staff engagement?
Mm-hmm. Yeah, if you could choose one tactic that had the most impact for employee engagement, what would it be?
Well, I mean, I think, and I know that the person asking the question, I can't ask a clarifying question, but I think the biggest tactic is doing kind of twofold. One, making it so that bringing technology. So technology, and we've talked about this at great length internally. Technology in and of itself will do nothing unless it's utilized and leveraged appropriately. And so we knew that going into that no matter what vendor we chose, we could have chose something that had robots that would tell us exactly what to do. But if you're not utilizing it to the best and maximizing it, you're not going to yield the results. So I think the biggest tactic, and we're going to see, right, because we're measuring this, but is with the ability to utilize technology that surrounds such a big part of their life. So being able to put all of the data even into the employee's hands, to be able to request a trade with an employee so that they can, go to their son's or daughter's baseball game, right, when they have a schedule. They don't need to go through the manager and then the manager, go through the files and say, well, I don't have coverage that day. Really, you're opening it up to say, look, this is as long as the patients are being taken care of and we're not, at a detriment to the financials, we'll let you do, we'll open that up for you. We'll let you trade and within, not into overtime and, and stuff like that. And so I think, for me, I think that is the single biggest thing to say, this is what our employees expect. And if they don't expect it now, the next generation of workforce is going to expect it.
Yeah, it's the empowerment and flexibility.
Right.
Mm-hmm. And I think that's a huge opportunity to end on, the empowerment and the flexibility that really leads to great patient care outcomes and outcomes for the whole system. So, Deb and Chad, you've done a wonderful job of being able to explain all this, and there's a lot of comments that we haven't been able to get to, but there's also a lot of comments saying thank you and that this has been very valuable. So, again, thank you so much for putting all this together, but above and beyond that, thank you for doing the work that's going to make a lot of difference to a lot of people. So let me turn this over to our partners at Becker's. Is there anything else we need to do?
No, thank you so much, Dr. Kerfoot, for your great presentation. Also, Chad and Deb, it was fantastic. With the Q&A over, that is all the time that we have for today. But once again, thank you to all of the presenters today and to API Healthcare for their excellent presentation. Please enjoy the rest of your day, and we look forward to having you join us for future webinars.
Thank you so much.
Mm-hmm.